In previous lecture, we started a new chapter in pharmacology and toxicology is hormone and hormone antagonists, in which first chapter in this hormone antagonist unit is hypoglycemic agents. So we discuss about hypoglycemic agents, in which what is pathophysiology of diabetes mellitus, clinical symptoms, then aims of treatment of this diabetic patient, and what is insulin, what is the role of insulin in diabetic patient, and it is secreted from which gland. So up to this part we covered in previous lecture. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
So hypoglycemic agents are the agents, they are used to lower the blood glucose level and used to treat the type 2 diabetes mellitus, is known as hypoglycemic agent. Then alpha cells and beta cells. Alpha cells secrete the glucagon while beta cells secrete the insulin hormone. And this insulin hormone regulate the glucose level, blood sugar level. So in the diabetes mellitus, pathophysiology of diabetes mellitus, it is a chronic disease. Chronic means
Long
Long-term.
term.
so it is long-term or lifelong disease and a group of metabolic disorder. It is characterized by high level of sugar in the blood, that is hyperglycemia. If the low level of sugar, it is termed as if the low level of sugar in the blood, then what it is termed as
Hypoglycemia.
Hypoglycemia.
so this insulin, it is secreted in the pancreas, in which beta cells which act as a hypoglycemic agent. This insulin, it is responsible to control or to maintain the blood sugar level, and the symptoms of diabetes mellitus patients are blurry visions, excessive thirst, fatigue, frequent urination, hunger, weight loss, and some other symptoms, in which we discuss clinical symptoms: ketonemia, hyperlipemia, hyperglycemia, azoturia, in which azoturia means there is abnormal or excess of nitrogen compounds present in the urine, that is azoturia. Ketonemia means presence of ketone bodies, high amount of concentration of ketone bodies present in the blood, it is known as ketonemia. Hyperlipemia means we are already discussed in anti-hyperlipidemic agent. What is mean by hyperlipemia? Which level is increases? Sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Hyperlipemia means
Level of lipid is increased.
there is increased level of lipid in the blood, is known as hyperlipidemia and hyperglycemia. So these are the clinical symptoms of the diabetes mellitus. Here in the screen, glucose in the blood, it is normal, and when excessive blood glucose level, that is in diabetic patient, by this way excessive blood glucose level. So this is about pathophysiology of diabetes mellitus. The next point is there are different types of diabetes mellitus: type 1, type 2, other specific types, and GDM, that is gestational diabetes mellitus. Also diabetes insipidus, then juvenile type, and maturity onset type of diabetes mellitus. Then next point, aims to correct, aims of the treatment, how to treat this diabetic patient. So what are the aims? These aims are given, in which to correct the firstly metabolic disturbances means metabolism correct करायचं to maintain the optimum body weight, to control the symptoms adequately with the diet, exercise and drugs. म्हणजे जे symptoms observe होतात ते symptoms adequately with the diet, exercise आणि drugs जे different drugs आहेत to treat this diabetes disorder, hypoglycemic agent, either they are oral or if it is insulin. So control these symptoms by using some drugs, by diet, by exercise, and prevent or delay the some vascular complications. So these are the aims to treat the diabetes mellitus. Then next, ideal properties. It should be effective by mouth. It should be non-toxic. It should be correct the metabolism defects in the diabetes. That is metabolism problems in the diabetes. It should be corrected by this anti-diabetic or hypoglycemic agents. Then next point, insulin. So insulin, it is where it is secreted. Insulin is obtained or produced from
Beta cells of Langerhans.
Beta cells.
So insulin, it is a polypeptide hormone and it is produced or secreted by beta cells of islets of Langerhans of pancreas. There are two types of the cell in the pancreas, which two cells? Second year, all are present.
Yes, ma'am.
Yes, ma'am.
Yes.
कोणत्या दोन सेल्स असतात?
Alpha cell and beta cell.
Alpha cell secrete glucagon and beta cell secretes the insulin. So beta cells secrete the insulin. So here we are discussing about insulin. आपल्याला हायपोग्लायसेमिक एजंट मध्ये इन्सुलिन डायबिटिक पेशंट मध्ये डायबिटीज ट्रीट करण्यासाठी कसा यूज होतो ते बघायचं आहे. आणि ओरल हायपोग्लायसेमिक एजंट मध्ये जे ओरली ऍज अ अँटी डायबिटिक एजंट म्हणून जे दिले जातात टॅबलेट्स अँड मेनी अदर प्रिपरेशन्स और डोसेज फॉर्म दे आर गिवन बाय द ओरली, तर ते आपल्याला ओरल हायपोग्लायसेमिक मध्ये बघायचे. आणि हायपोग्लायसेमिक एजंट फर्स्ट चॅप्टर आहे त्याच्यामध्ये ओनली वी हॅव टू डिस्कस अबाउट इन्सुलिन and pathophysiology of diabetes mellitus. So here we discuss about insulin. So insulin, it is a polypeptide hormone. It is produced by beta cells of islets of Langerhans of pancreas. Then it has profound influence on the metabolism of carbohydrate, fat, and protein. Means insulin shows their influence or effect or action on the metabolism. Metabolism means conversion of complex form to the simpler form. So त्याचं कन्वर्जन कार्बोहायड्रेट, फॅट आणि प्रोटीनच्या मेटाबॉलिझम वरती हा इन्सुलिन इफेक्ट करत असतो. Then it is considered as an anabolic hormone. There are two types, anabolic, anabolism, catabolism. These are the types of metabolism. So insulin here act as a anabolic hormone, in which insulin, it is polypeptide hormone where it is secreted by beta cells of islets of Langerhans of pancreas, and it is discovered in 1922 by Banting. So it is discovered in 1922 by Banting and it is derived from Latin word insula. Which Latin word?
Insula.
Insula Latin word पासून insulin हा वर्ड डिराइव्ह झालेला आहे आणि इट इज फर्स्टली डिस्कवर्ड इन द इयर 1922 by Banting scientists. Then having the molecular weight, its molecular weight किती आहे?
600.
100.
6,000.
This one asked for objective question, molecular weight of insulin. So molecular weight of insulin is 6,000 and it consisting of 2 amino acids. याच्यामध्ये 2 amino acids असतात such as A and B. It having the 2 amino acids chains, दोन amino acidचे chains आहेत A and B, in which and this both the chains, they are linked by a bond. That bond is known as disulfide bond or disulfide bridge. So each A and B chain contain 21, म्हणजे A chain जे आहे त्याच्यामध्ये 21 amino acid आहेत आणि B chain जे आहे त्याच्यामध्ये 30 amino acids आहेत. म्हणजे टोटल किती amino acid आहेत इन्सुलिन मध्ये?
51.
51. So molecular weight of insulin is 6000 and it consisting of two amino acid chains such as A and B, and they are linked by a disulfide bridge or disulfide bond, and both the chains consist of 51 amino acid, in which A consists of 21 and B consists of the 30. This one also asked for MCQ. Then it is obtained from pancreas of cattle and pigs. Do you know this animal, cattle and pigs?
Yes, ma'am.
Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, so it is obtained from the pancreas of the cattle and pigs. Also, insulin, it is human insulin, which can be biosynthesized by cultures of bacteria of E. coli and available for the clinical use. म्हणजे ह्युमन इन्सुलिन जे आहे ते जे काही कल्चर्स आहेत बॅक्टेरिया ऑफ इकोलाई, इकोलाई माहितीये, इचेस्टिया कोलाई. The cultures पासून human insulin, it can be biosynthesized by cultures of bacteria. बॅक्टेरियाच्या कल्चर्स पासून ह्युमन इन्सुलिन हे बायोसिंथेसाइज केले जातात आणि ते क्लिनिकल यूज साठी अवेलेबल असतात. They are available for the clinical use. So this is about theory behind the insulin. The next point, storage. So in human pancreas there are 2 million islets of most of them concentrated in the tail of pancreas. Do you know structure of pancreas? What are the parts of pancreas? माहिती है का structure, anatomy, physiology of pancreas? Do you know? Yes or no?
No, ma'am.
माहिती है का? Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
Question काय विचारले समजले?
Yes, ma'am.
Yes,
माहिती का नाही हे विचारले?
No, ma'am.
no.
Pancreas, it is part of pancreas, liver, in detail study केलाय तुम्ही anatomy मध्ये फर्स्ट इयर मध्ये. It is one of the part of body and you don't know about it very well. So this is structure in which ear, head and tail, body, neck, head proper. In detail study about pancreas, about their anatomy and physiology. You have to know when you have studying for diabetes mellitus or insulin. So here in the human pancreas there are 2 million islets of them, 2 millions of islet out of most of the concentrated in the tail of pancreas. म्हणजे pancreas जे tail structure आहे त्याच्यामध्ये त्या concentrated असतात. Insulin, it is stored in the form of granules. Granules च्या form मध्ये ते store केले जातं. And the storage of insulin facilitated by zinc, which makes insulin less soluble. Storage हे zinc नी facilitate केलं गेलं आहे, means zinc is used in their storage, and because of this is used in their storage, it makes the insulin less soluble. In normal humans, 200 units of insulin is present, and a normal individual secrete insulin about 50 units daily. किती units मध्ये daily secrete करता insulin?
50
We all secrete the
daily.
means we all secrete the insulin in daily. How many units? Screen is visible to all.
daily.
50 units.
Yes, ma'am.
50 units daily. Insulin, it is synthesized within the beta cells as a single chain polypeptide precursor called as a pro-insulin. Insulin हे beta cells, pancreas मध्ये जे cells असतात अल्फा and बीटा, in which beta cells मध्ये ते synthesize केलं जातं as a single chain. एक single chain म्हणून as a single chain of polypeptide. Insulin, it is a polypeptide hormone. That's why it is synthesized in beta cell as a single chain polypeptide precursor and it is termed as proinsulin. High circulating level of glucose stimulate the release of insulin. जो high circulate होण्याची level आहे ग्लुकोजची ब्लड मधून ती काय करते इन्सुलिनचा रिलीज स्टिम्युलेट करते एनहान्स करते अंडर द फास्टिंग कंडिशन and the pancreas secretes 20 microgram of insulin per hour. Fasting condition माहिती आहे? Yes or no? जर तुम्ही रिप्लाय दिला तर आपण नेक्स्ट पॉइंट पुढे जाणार आहे. So why you are wasting time? Under fasting condition, pancreas secrete 20 microgram of insulin per hour. या सेंटेन्सचं मीनिंग समजतंय?
Yes, ma'am.
Yes, ma'am.
Under fasting condition, the pancreas secrete 20 microgram of insulin per hour. या fasting condition मध्ये pancreas 20 microgram मध्ये insulin secretes करतात. In beta cells, insulin is released by exocytosis. Insulin हे exocytosis process नी release होतं. Then amino acid, fatty acids, ketones and non-glucose also stimulate the insulin release. Amino acids, fatty acids and ketones and जे non-glucose substances आहेत ते काय करतात इन्सुलिनचा रिलीज स्टिम्युलेट करतात इन्हान्स करतात to promote the release of insulin. Which substances? Which substances stimulate the insulin release?
Amino acid, fatty acid.
Amino acid, fatty acid, ketone, and non-glucose.
The next point about insulin transport fat excretion. In the transport, mean how it is transmitted or where it is degraded. This point covered in this point. Insulin, it is disappear rapidly from the plasma. Plasma पासून तो rapidly disappear होत असतो and their half life. किती half life?
5 to 6
5
minutes.
to 6 minutes.
5 to 6 minutes.
Then it circulates in the plasma in free non-protein bound form. Free non-protein bound form मध्ये तो plasma मधून insulin circulate होतो. That is transport. It is about transport. It circulates in the plasma in the free non-protein bound form. It is completely degraded by most of tissue. म्हणजे ज्या टिश्यू आहे त्याच्यापासून हा completely degrade होतो. Degraded means destroy, especially by liver, kidney, pancreas, etc. So it is completely degraded by most of tissue, in which especially by liver, by kidney, and by pancreas, and it is appear in the urine. हे डिग्रेड ज्यावेळेस होतं टिश्यू मुळे किंवा लिव्हर किडनी पॅनक्रियास या ऑर्गन मुळे तर त्याच्यामुळे ते कम्प्लिटली डिग्रेड होते डिस्ट्रॉय होते and after that it is appear in the urine. So this is about transport and excretion. The next one, pharmacological action. When it is administered in the diabetes mellitus, insulin recorrect the disturbance in the carbohydrate, fat, protein, electrolytes, and water as follows. म्हणजे ज्यावेळेस insulin administered केलं जातं at that time generally insulin कोणत्या रूटने घेतो आपण? Commonly it is given by which route?
Intramuscular.
What do you think?
Intramuscular route.
Intramuscular route.
Means by parental route, right?
Yes, ma'am.
Yes,
ma'am.
ma'am.
Okay. So when it is administered or it is given into the diabetic patient. At that time, the work or function of this insulin to recorrect the disturbance in the कार्बोहायड्रेट म्हणजे जे मेटाबॉलिझम मध्ये चेंज झालेला आहे कार्बोहायड्रेट फॅट आणि प्रोटीनच्या आणि वॉटर आणि इलेक्ट्रोलाइट इम्बॅलन्स झालाय तर तो फर्स्टली ते मेंटेन करतं. In diabetes mellitus, carbohydrate metabolism it is totally disturbed. म्हणजे ते मेटाबॉलिझम कुठेतरी डिस्टर्ब झालंय. That's why that individual or person suffer to the diabetes. Because of improper metabolism of carbohydrate, it leads to there is increase the level of glucose, and when increase the level of glucose or sugar in the blood, then it leads to which disorder?
Diabetes mellitus.
Diabetic mellitus.
Then it leads to hyperglycemia. That is diabetes mellitus, and hyperglycemia it is characterized symptom or state of the diabetes mellitus disorder. So ते जे डिस्टर्बन्स झालेला आहे ते फर्स्टली इन्सुलिन करेक्ट करतं. इट फॅसिलिटेट द एंट्री ऑफ ग्लुकोज अँड अदर शुगर इनटू द सेल. सेल मध्ये ज्या अदर ग्लुकोजची एंट्री आहे and also other sugar जे आहेत. Other sugar means maltose, lactose, fructose, sucrose. तर त्यांची सेल मधली एंट्री जी आहे त्याला फॅसिलिटेट करते. The next point, it facilitates phosphorylation of glucose and promote the glucagon synthesis. Phosphorylation process जी आहे ग्लुकोजची त्याला हे फॅसिलिटेट करतं and because of this it promotes the glucagon synthesis. Glucagon synthesis it is also responsible. The glucagon कशामध्ये कन्वर्ट होणार आहे नंतर by glycogen lysis process नी
ग्लुकोज मध्ये
ग्लुकोज मध्ये म्हणजे ते at the end काय करते it maintain the balance of or maintain the normal level of glucose. Insulin inhibit glycogenolysis and gluconeogenesis, thus increase the utilization of glucose. म्हणजे ज्या प्रोसेस होतात बॉडी मध्ये आपल्या ग्लुकोजेनोलायसिस जे फर्स्ट लेक्चर मध्ये सांगितले की ग्लायकोजन it is converted in glucagon it is secreted by alpha cells and then it is converted into glycogen and after that it is converted into the glucose. This process is known as glycogenolysis. तर ती प्रोसेस इनहिबिट करतं इन्सुलिन. That's why there is no synthesis of there is inhibition of conversion of this glucagon to glycogen. That is there is no storage of glycogen is available and it increases. म्हणजे ह्या ज्या प्रोसेसेस आहेत ग्लायकोजिनोलायसिस एक्सेस ऑफ ग्लुकोज होऊन नंतर ते ग्लायकोजन मध्ये कन्वर्ट होते. आफ्टर दॅट इट ग्लायकोजन इज कन्वर्टेड इनटू ग्लुकोज. म्हणजे हे जे कन्वर्जन आहे ग्लुकोनिओजेनेसिस ग्लायकोनिओलायसिस तर ते इनहिबिट करतं आणि युटिलायझेशन म्हणजे ग्लुकोज जे प्रॉपर अमाउंट मध्ये लागणार आहे त्याची जी नॉर्मल रेंज आहे त्यात सच मेंटेन करतं युटिलाइज करतं. That's why the neat result of insulin action is carbohydrate metabolism and it is used of this glucose as a fuel. म्हणजे glucose as a fuel म्हणजे काय ATP as a ATP एनर्जी सोर्स म्हणून यूज करतो का?
Yes, ma'am.
म्हणजे जर कार्बोहायड्रेटचं प्रॉपर मेटाबॉलिझम झालं बिकॉज ऑफ insulin it maintain the carbohydrate metabolism, so it leads to proper use of this glucose as a fuel and storage of this glucose in the form of glycogen and this will be reduce the blood glucose level up to the normal level in the diabetic patient. So must be a pharmacological action.
Yes, ma'am.
How
Yes,
it act on the metabolism, how it maintain the metabolism of carbohydrate fat and promote the glycogen synthesis, inhibit this gluconeogenesis, glyconeolysis, and then utilize this glucose and maintain the normal blood sugar level in the diabetic patient. The next point, in the diabetes mellitus, insulin deficiency causes mobilization of fat from the adipose tissue into the bloodstream and the availability of Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So in which next pharmacological action of insulin, in which in the diabetes mellitus patient, insulin deficiency causes mobilization of fat from the adipose tissue. Adipose tissue माहिती आहे?
Yes, ma'am.
The adipose tissue from the mobilization of fat from the adipose tissue into the bloodstream. इन्सुलिनची डिफिशियन्सी असल्यामुळे काय होतं डायबिटीज पेशंट मध्ये मोबिलायझेशन ऑफ फॅटचं मोबिलायझेशन होतं फ्रॉम दी mobilization means movement of fat from adipose tissue into the bloodstream म्हणजे circulatory system मध्ये. The availability of free fatty acid to the liver, it leads to increase the production of acetoacetic acid, ketone bodies, and which causes metabolic acidosis. जे फ्री मध्ये फर्स्टली काय इन्सुलिनची डिफिशियन्सी असेल तर काय होतंय मोबिलायझेशन ऑफ फॅट फ्रॉम ऍडिपोज टिश्यू इनटू द ब्लड स्ट्रीम आणि जे फ्री फॅटी ऍसिड अवेलेबल आहेत लिव्हर मध्ये ते काय करतात इनक्रीज करतात प्रोडक्शन increase the production of acetoacetic acid ketone bodies which causing acetoacetic या ketone bodies आहेत त्यांचं प्रोडक्शन इनक्रीज झाल्यामुळे it leads to metabolic ketoacidosis म्हणजे कीटोन आणि ऍसिडोसिस म्हणजे ऍसिडची लेवल जी काय आहे ती बॉडी मध्ये इनक्रीज होते ड्यूरिंग द मेटाबॉलिझम दॅट्स व्हाय इट इज टर्म्ड ॲज मेटाबॉलिक कीटोएसिडोसिस. Then insulin administration stimulates synthesis of fatty acid and triglyceride. Triglyceride it is also type of lipid. मग ट्रायग्लिसराइडचा आणि जे फॅटी ऍसिड्स आहेत त्यांचं सिंथेसिस इन्सुलिनच्या ऍडमिनिस्ट्रेशन मुळे स्टिम्युलेट होतं. Thus, it antagonizes the metabolic ketoacidosis. मग ते इन्सुलिन म्हणजे हे जो सेकंड पॉइंट आहे अप टू द मेटाबॉलिक ketoacidosis हे का होतंय बिकॉज ऑफ देयर इज डिफिशियन्सी ऑफ इन्सुलिन. मग हे कशामुळे ट्रीट केलं जातं दस इट अँटागोनाइज द मेटाबॉलिक कीटोएसिडोसिस. मग इन्सुलिनचं ऍडमिनिस्ट्रेशन केल्यानंतर इथं काय होती डिफिशियन्सी होती. आफ्टर दॅट when administered the insulin then what happen there is synthesis of fatty acid and triglyceride is stimulated and that's why it antagonizes this metabolic ketoacidosis disorder. समजलाय second point?
Yes,
Yes, ma'am.
In insulin deficiency in the diabetes patient, it impairs the protein synthesis and favors the protein breakdown in the muscle. म्हणजे इन्सुलिनची डिफिशियन्सी असेल डायबिटीज पेशंट मध्ये तर प्रोटीनचं सिंथेसिस प्रॉपरली होत नाही दॅट इज इम्पियर्स and which favor the protein breakdown. सिंथेसिस प्रॉपरली नाही झालं तर ते काय होतात मसल्स मध्ये प्रोटीनचं ब्रेकडाऊन होतं. देन इन्सुलिन ऍडमिनिस्ट्रेशन केलं तर काय होणार आहे प्रोटीन म्हणजे काय असतात अमायनो ऍसिड्स असतात. These are the chain of amino acids. So insulin administration enhance the transfer of amino acid into the cells and promote their conversion into the protein. Protein कशापासून बनलंय? What is meant by protein? You are already study in DCP, protein, carbohydrate, fatty acid. So what is meant by protein?
Long chain of amino acid.
So it is long chain of amino acid. मग ज्यावेळेस डिफिशियन्सी असते डायबिटीज पेशंट मध्ये प्रोटीनच्या इन्सुलिनची त्यावेळेस काय होणार आहे की प्रोटीनचं सिंथेसिस प्रॉपरली होत नाही आणि प्रोटीनचं सिंथेसिस ॲक्युरेटली होत नाही दॅट्स वाय इट लीड्स टू ब्रेकडाऊन ऑफ दिस प्रोटीन मॉलिक्यूल इनटू द मसल. मग ज्यावेळेस इन्सुलिनचं ऍडमिनिस्टर केलं जाईल अशा कंडिशन मध्ये मीन्स डायबिटीज पेशंट मध्ये तर ते काय करणार आहे then it enhance the transfer of amino acid. मग इन्सुलिनचं ऍडमिनिस्ट्रेशन केल्यामुळे अमायनो ऍसिडचे ट्रान्सफर इन्हान्स होतं and that's why this amino acids into the cell दे प्रमोट द सिंथेसिस ऑफ कन्व्हर्जन. म्हणजे डायबिटीजच्या पेशंट मध्ये इन्सुलिनची डिफिशियन्सी असल्यामुळे प्रोटीनचं सिंथेसिस होत नाही. ते इन्सुलिन ऍडमिनिस्टर्ड केल्यानंतर प्रॉपरली होतं. दिस इज फार्माकोलॉजिकल ऍक्शन ऑफ third pharmacological action of insulin. Do you understand?
Yes, ma'am.
Then fourth, insulin enhances the entry of potassium ions into the cell and its involvement into the gluconeogenesis. Insulin antagonizes the excess of body water loss. This is again next pharmacological action of insulin. Insulin काय करता है? Excessive body water loss होता है. ते antagonize करता है. Insulin antagonize the excess of body water. म्हणजे excess of body water चा जो लॉस होतोय ते इनहिबिट करते, अँटागोनाइज करते, म्हणजे त्याच्या ऑपोजिट करते. इट प्रिव्हेंट द वॉटर लॉस, एक्सेसिव्ह बॉडी वॉटर लॉस. इन्सुलिन इनहान्स द एंट्री ऑफ पोटॅशियम इनटू द सेल्स. सेल्स मध्ये पोटॅशियम आयनची एंट्री इन्सुलिन इनहान्स करतं आणि ऑल्सो इट्स इन्व्हॉल्वमेंट इन द ग्लुकोनिओजेनेसिस. Gluconeogenesis means sound is audible to all.
Yes, ma'am.
Yes, ma'am.
What is gluconeogenesis? It is metabolic pathway. It results there is generation of glucose from the insulin. So in which excessive glucose, it is after that it is converted into the glycogen. So insulin काय करणार आहे? पोटॅशियम आयनची एंट्री सेल मध्ये इन्क्रीज करतं आणि जी ग्लुकोनिओजेनेसिस प्रोसेस आहे त्याच्यामध्ये इन्व्हॉल्व होतं. So these are the pharmacological actions of insulin. The next point, preparation of insulin. Screen is visible to all.
Yes,
Yes, ma'am.
Roll number 29. Are you present? Mane, are you present?
Yes, ma'am.
Read the slide. Slide read kara.
Yes, ma'am. Commercial insulin is a mixture of the hormone extracted from the pancreas of cattle or pigs. The potency of the insulin is assured by the comparing the new sample with an international standard for its hypoglycemia effect. Preparations are adjusted to contain 14, 1800 and 500 units ml according to needs.
Okay, sir. So we are discussing about preparation. After the pharmacological action, next point is preparation. Commercial insulin is a mixture of hormone and it is extracted from insulin. Commercially जे available असलेले insulinचं preparation आहे ते काय आहे? It is mixture of hormone and that hormone, this mixture, it is extracted from. Extraction process माहिती आहे का? So ticks first मध्ये झाला cell extraction, drying. Extraction, it is process in which to extract out an active ingredient. So जे pancreas of cattle किंवा pigs चे जे pancreas आहेत त्या pancreas मधून हा हार्मोन एक्स्ट्रॅक्ट केला जातो. फक्त जो हार्मोन आपल्याला डायबिटिक पेशंट मध्ये युजफुल आहे तो कॅटलच्या पॅनक्रियाज मधून इन दी फॉर्म ऑफ म्हणजे बोविन हे जे हार्मोन आहेत which is same that of the insulin. So it is known as bovine insulin and pig पासून जे हार्मोन एक्स्ट्रॅक्ट केले जातात that is known as porcine insulin. तर ते हार्मोन एक्स्ट्रॅक्ट केले जातात आणि आफ्टर दॅट त्याचं प्रिपरेशन प्रिपेअर केलं जातं which is used for or given for the diabetic patient. And the potency of insulin assayed by comparing the new sample with the international standards for its hypoglycemic effect. म्हणजे हे जे प्रिपेअर केलेलं मिक्सचर आहे देन पोटेन्सी, त्याची पोटेन्सी चेक केली जाते. इज ऍसिड, ऍसिड म्हणजे ऍसे केलेत का तुम्ही केमिस्ट्री मध्ये?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
कशासाठी परफॉर्म करत होता ऍसिडची प्रॅक्टिकल? स्टँडर्ड सोल्युशन टेस्ट सोल्युशन होतं का?
Yes, ma'am.
ओके सो टू पोटेन्सी, तर पोटेन्सी चेक जे मिक्सचर आपण प्रिपेअर केलंय हे इन्सुलिन जे ऍज अ बोविन आणि ऍज अ प्रोसीन हार्मोन्स जे एक्स्ट्रॅक्ट केलेलं आहे तर त्याचं मिक्सचरची पोटेन्सी ही काय करायची? ऍसिड मीन्स टू चेक आउट बाय कम्पेअरिंग विथ द इंटरनॅशनल, म्हणजे ज्या इंटरनॅशनल स्टँडर्ड्स आहेत त्या स्टँडर्ड्स बरोबर त्याची पोटेन्सी चेक करायची, असे करायचे, इव्हॅल्युएट करायची फॉर हायपोग्लायसेमिक इफेक्ट, म्हणजे त्याचा एक्झॅक्ट हायपोग्लायसेमिक इफेक्ट आहे का त्याच्यासाठी. देन प्रिपरेशन्स आर ऍडजस्टेड टू कंटेन 40, 80, 100 and 500 units per ml. म्हणजे त्या प्रिपरेशनची व्हॉल्यूम किंवा जो डोस आहे तो किती आहे? इट इज 40, 80, 100, 500 units per ml अकॉर्डिंग टू नीड. म्हणजे जशी गरज आहे त्यावेळी बाय दिस व्हॉल्यूम ह्याच्या युनिट्स मध्ये पर ml जे प्रिपरेशन्स आहेत ते यूज करायचे आहेत. सो फर्स्ट प्रिपरेशन अबाउट कमर्शियल इन्सुलिन मिक्सचर. This one also asked for MCQ. Bovine. It is obtained from which animal?
Cattle.
Pancreas of cattle. And porcine insulin, it is obtained from pancreas of pig. Then next, newer insulin, म्हणजे न्यू फॉर्म मध्ये जे प्रिपरेशन्स अवेलेबल आहेत. So these are this first one, Actrapid. It is clear neutral solution. Actrapid, it is a clear neutral solution. Their pH 7 and it is recrystallized monocomponent of porcine insulin. Porcine insulin, it is obtained from pancreas of which animal?
Pig.
Pig. So Actrapid, it is हे काय आहे? Clear neutral solution आहे, त्याचा pH 7 and it is recrystallized monocomponent of porcine insulin. Porcine insulin पासून हा recrystallize केलेला आहे. Then next preparation कोणता आहे? Rapitard. It is cloudy mixture. Clear आणि cloudy difference माहिती आहे? माहिती आहे? Yes or no?
Yes, ma'am.
So cloud, it is Rapitard. It is a newer insulin preparation and it is cloudy mixture of Actrapid. म्हणजे Actrapidच हे cloudy mixture आहे आणि large insoluble crystals of bovine. म्हणजे same first जे preparation आहे Actrapid त्याचं cloudy mixture जे आहे ते Rapitard म्हणून यूज केलं जातं. But there is addition of large insoluble crystals of bovine insulin. Bovine insulin चे त्याच्यामध्ये insoluble crystals ऍड केलेले आहेत. Then next and last preparation कोणतं आहे? Monotard. Monotard. So it is mono component. Mono means two or one, single or double.
Single.
Okay, so it is a mono component of insulin zinc suspension of arid contain purified porcine insulin. Okay, so last monotard preparation. This it is a mono component of insulin zinc suspension. हे insulin zinc suspension चं mono component आहे and it contain purified porcine insulin. Porcine insulin, it is obtained from pancreas of pig. So there are three preparations in the newer insulin preparation: Actrapid, Rapitard, and Monotard. Here we complete preparations. All the insulin preparations are administered by parentally by subcutaneous route. And regularly, insulin can be administered by either intravenously or intramuscular route. Then the preparations of insulin are marketed in 10 ml vials. म्हणजे जे vials माहिती आहेत का? Ampoules vials.
Yes, ma'am.
Okay, so they मार्केटेड प्रिपरेशन जे आहेत इन्सुलिनचे जे इंट्राव्हेनस रूटनी किंवा सबक्युटॅनियस और इंट्रामस्क्युलर दॅट इज ऑल दी पॅरेंटल रूट्स यांनी जे घेतले जातात ते प्रिपरेशन 10 ml च्या व्हायल्स मध्ये हे इन्सुलिनचे प्रिपरेशन अवेलेबल आहेत. आणि आपण सेपरेट स्टडी का करतो इन्सुलिन फर्स्टली हायपोग्लायसेमिक इन्सुलिन हा ही हायपोग्लायसेमिक आहे आणि जे रिमेनिंग एजंट बघणार आहेत ते पण हायपोग्लायसेमिकच आहे बट दे आर गिवन बाय ओरल रूट. समजते का डिफरन्स? आपण 2 चॅप्टर मध्ये का स्टडी करतोय?
Yes, ma'am.
Yes.
Okay. The next point, side effect of insulin. Roll number 44. Are you present?
Yes, ma'am.
Read the side effect.
Hypogalemia, insulin allergy, insulin
Lipodystrophy. Next.
insulin presbyopia, insulin resistance, and obesity.
Okay, so these are the side effects. In which first one का है hypoglycemia. Hypoglycemia माहिती है? Name indicate. Hypo means lower the level of glucose in the blood. So it is common adverse effect and it may be result due to too large dose of insulin. म्हणजे जास्त जर का डोस झाला. It is a common adverse effect. Wait for a minute. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
So first one side effect is hypoglycemia. Then second, it is common adverse effect. Adverse effect मध्ये येतो in which too large dose of insulin injected. It is occurred due to too large dose of insulin injected, failure to eat the properly balanced diet. Diet म्हणजे properly balanced diet नाही घेतला तर it leads to hypoglycemia. Then next काय आहे insulin allergy. It is characterized by local itching, redness, swelling म्हणजे जे anti inflammation च्या related आहे. Itching sensation, redness, swelling ते occur होतं. At the site of injection, insulin allergy, it is characterized by local itching sensation, redness, swelling, pain at the site of injection. Then next, insulin lipodystrophy. It is characterized by the atrophy of subcutaneous fat at the site of frequent injections. म्हणजे हे ज्यावेळेस पॅरेंटली घेतले जातात at that time which side effects observed ते सांगितलेलं आहे. इन्सुलिन atrophy माहिती आहे? Atrophy of subcutaneous fat or atrophy of tissue. माहिती आहे का? Yes or no? Sound is audible to all?
Yes, ma'am.
Yes.
Insulin lipodystrophy याच्यामध्ये काय आहे? It is characterized by atrophy of subcutaneous fat at the site of frequent injections. म्हणजे insulin lipodystrophy means ज्या ठिकाणी ज्या साइटला इंजेक्शन दिले जातात बॉडी और टिश्यू ऑर्गन there is degeneration of cell is occur. That is lipodystrophy. Then next, insulin neuropathy. Then next, insulin presbyopia. Insulin resistance. Insulin resistance means due to repeated administration of insulin in the daily requirement, it gradually increases due to the formation of insulin antibodies, which is required exceed 200 units per day which is believed that insulin resistance has been developed. म्हणजे जेवढी प्रॉपर त्याची निळा आहे त्याच्यापेक्षा जास्त असेल तर insulin resistance this is side effect is occur जर का रॅपिडली किंवा रिपीटेडली ऍडमिनिस्ट्रेशन असेल आणि सिंथेसिस झालं असेल मग डेली रिक्वायरमेंटची जेवढी गरज आहे त्याच्यापेक्षा एक्सीड होत असेल at that time insulin resistance is occur. पाहिजे त्याच्यापेक्षा जास्त असेल तर रेजिस्टन्स गरजेचं आहे की आज सिक्रिशन कंटिन्यू राहायला पाहिजे. If our need is complete, then there is need to stop or resist the secretion. Insulin presbyopia means it in which it is loss of visual accommodation due to alteration in physical properties of lens. म्हणजे जे ब्लड विजन सिम्पटम आपण बघतोय डायबिटीज मध्ये तर ते प्रिस्बायोपिया त्याच्यामध्ये काय आहे की व्हिज्युअल अकोमोडेशन अल्टरेशन इन फिजिकल प्रॉपर्टीज ऑफ लेन्स इट इज अकरिंग ड्यू टू रॅपिडली कंट्रोल ऑफ डायबिटीज विथ द इन्सुलिन. म्हणजे व्हिज्युअल अकोमोडेशन आलं व्हिज्युअल चेंजेस अल्टरेशन आलं then that is side effect is here written in the term insulin presbyopia. So these are the side effect of insulin. And obesity माहिती आहे overweight लठ्ठपणा that is obesity. The next point therapeutic applications. What are the therapeutic applications of insulin? Can anyone read?
In diabetes mellitus, in schizophrenia, in anorexia, and in burnout.
Okay, so therapeutic applications of insulin. It is used in firstly diabetic patient or in the diabetes mellitus disorder. Schizophrenia. Schizophrenia means we are already discussed in antipsychotic or psychopharmacological agent. What is mean by schizophrenia? It is major psychosis or minor psychosis?
Major psychosis.
Major psychosis.
Major psychosis.
Okay, so schizophrenia it is a mental or long-term disorder. So in which this insulin is also therapeutically applicable. In anorexia, anorexia means it is used in anorexia nervosa where insulin improve the appetite. Anorexia याच्या अगोदर anorexia meaning सांगितलंय. Anorexia. What is mean by anorexia?
Fear to overweight.
It is a
Yes,
digestive.
repeat again.
Fear to overweight.
Okay, also loss of appetite or the feed.
Okay.
Then anorexia, it is a disorder in which there is loss of appetite for the food. So in anorexia condition, anorexia nervosa, in this condition, it is also applicable, which म्हणजे symptom काय आहे त्याच्यामध्ये symptoms काय होते डायबिटीजचे excessive thirst, hunger, right? मग ते कव्हर कोण करणार आहे ते सिम्पटम्स कव्हर कोण करतं इन्सुलिन म्हणजे ऑफकोर्स इट इज युज्ड इन सच टाइप ऑफ कंडिशन अनोरेक्सिया म्हणजे ज्यांच्यामध्ये लॉस ऑफ ॲपेटाइट लॉस ऑफ फूड इनटेक आहे त्या पेशंट मध्ये जर इफ वी इंजेक्ट सच टाइप ऑफ प्रिपरेशन्स देन इट कॅन बी इझिली इंटेक दिस फूड्स देन इन बर्न्स मध्ये ऑल्सो दिस therapeutically applicable by this insulin with the glucose administration it reduces the nitrogen and potassium loss in the burn patient म्हणजे बर्न झालेल्या पेशंट मध्ये नायट्रोजन आणि पोटॅशियमचा जो लॉस झालेला आहे it will be covered by insulin with the glucose administration. So these are the therapeutic applications of insulin. Here we complete first hypoglycemic agent in which we discuss firstly what is mean by hormone antagonist, hypoglycemic agent, alpha cell, beta cell, their secretion, what is mean by gluconeogenesis, glycogenolysis, what is mean by diabetes mellitus, what happened in this disorder, then what are the symptoms of this disorder, Then types, how to correct this disorder, what are the aims or objective to treat this disorder, and ideal properties of this anti-diabetic agent. आता hypoglycemic agent, आपण याला anti-diabetic agent म्हणू शकतो का? Can we say or use this hypoglycemic agent are also termed as anti-diabetic agent? Is it possible or is it suitable to use this term? Yes or no?
Yes, ma'am.
As per your
Yes, ma'am.
interpretation,
Ma'am.
we can use or not?
यूज करू शकतो ना.
अँटीडायबेटिक म्हणजे काय? डायबिटीजच्या पेशंटला किंवा डायबिटीज डिसऑर्डर आहे त्याला ट्रीट करतात. These agents are known as anti-diabetic agents. मग hypoglycemic agents काय करतात? They are also reduce the increased level of glucose or blood sugar level जी increase झाली आहे डायबिटीज पेशंट मध्ये ते काय करतात? रिड्यूस करतात. मीन्स both of these agents having the same purpose. They treat or they normalize the increased level of blood sugar level up to the normal level. So we can easily use this both having the same anti-diabetic as well as the hypoglycemic agent. So ideal properties of this anti-diabetic agent we discuss. After that, insulin, their theory. After that, transport, how it is transported, how it is excreted, then their pharmacological actions. If there is deficiency of insulin, then what happened? And if we administer the insulin, some preparation, then how it recovered this disorder or this deficiency. We study in pharmacological action. After that, we discuss their preparations, in which commercially preparation by using this or secreted the insulin in the form of bovine insulin from the pancreas of cattle, in the form of porcine insulin from the pancreas of pig. And then next point, their newer preparations, their side effect, and last point is therapeutic applications of hypoglycemic agents such as insulin. Here we complete hypoglycemic agent. Do you have any doubt related to this chapter?